Hi, this is Dr. Spencer Zimmerman with Idaho Brain and Body Institute. What you just saw there was an oxygen concentrator. So what it does is it takes the air in the room and it concentrates the oxygen and it's going to put it into this chamber. Now, and then it's going to pressurize it. And so really what most people are getting in here, this is a hyperbaric oxygen chamber. They'll get about 95 to 98% oxygen that is then pressurized up to a set point. And the reason why it's pressurized is to help it better to get into your tissues to allow for healing. If you know a lot about hyperbaric oxygen chambers, you're probably thinking about the ones you see in wound care clinics that are used for amputations. Is really the main thing it's used for diabetics, ulcers that aren't healing, amputations, surgeries where things just aren't healing up right is the predominant thing it's used for. What we do is we use it as a way to help facilitate healing and recovery. Because with the patients we see, concussions, traumatic brain injuries, strokes, and so forth, the brain has been injured. Now, when it's injured and not able to do its job right, it's typically not getting as much blood flow and oxygen. So for concussions, for example, we know that blood flow and oxygen is reduced going to the brain for at least a year from the time that injury has happened. And so this is used as a way to facilitate that recovery and allow people to progress quicker. Now the chamber we have, there's a lot of different ones out there that people buy. It's a solid 3 feet in diameter, so there's some other smaller chambers that you may have experience with, and people are worried about claustrophobia. So there is a window here, there's a window at the end, but because of the size it is, the majority of people who are a little scared do really well and don't have any issues. Now, if you look at the chamber and you're like, oh, you start hyperventilating, we're not gonna let you do it, you're not a good fit. And you probably shouldn't look anywhere else to do it either, because you're not gonna get out of it what you could. But hyperbaric oxygen therapy is a great way to help facilitate recovery in head injuries, TBI, strokes. Also can even help with post-surgical wounds to heal up quicker than if it's not done as what we typically see with our patients. So this is just one of the many tools and therapies that we have available to our patients here at Idaho Brain and Body Institute to help them recover quicker than they are likely to do without it. So if you found this video useful, please give us a like, comment, and tag someone who you think would benefit, or share it with them. And just look for our other videos where we go into other therapies and diagnostic tools that we have to allow our patients to gain their life back.